You might be maintaining workout habits that are inflaming your prostate without realizing it. Right now, thousands of men over 50 are unknowingly making their urinary symptoms worse through their exercise routines. These aren't just random exercises I'm talking about, but the specific way you're performing them that's creating problems. Today I'm going to reveal the 5 worst workout habits that are sabotaging your prostate health. These habits aren't obvious, which is exactly why they are so dangerous for men dealing with prostate issues. You could be doing everything right with your diet and supplements, but if you're making these exercise mistakes, you're fighting an uphill battle. The worst part is that most fitness trainers don't understand the connection between certain workout patterns and prostate inflammation. They are giving advice that works for younger men but creates serious problems for mature men. My name is Dr. Isabel Lopez, and I specialize in men's health, particularly for those over 50 dealing with prostate concerns. I've seen countless patients who thought they were doing everything right with their fitness routine, only to discover their workouts were making their symptoms worse. Before we dive deep into these 5 dangerous habits, I want to know where you're watching from today. Drop a comment with your city so I can see how far this important message is reaching. Make sure to follow this channel because I regularly share critical health information that most doctors won't tell you about prostate care. These 5 habits I'm about to reveal could be the missing piece in your prostate health puzzle. Some of these might shock you because they are incredibly common in most workout routines. But the first habit is something almost every man does wrong, and it's creating massive pressure exactly where you don't want it. The first habit that's wreaking havoc on your prostate is holding your breath during strength training exercises. This technique, known as the Valsalva maneuver, involves holding your breath while exerting force during a lift. While some trainers teach this for core stability, it creates dangerous pressure spikes throughout your abdominal cavity. This increased pressure doesn't just stay in your chest, it pushes down directly onto your bladder and prostate gland. When you hold your breath during heavy lifting, you're essentially creating a pressure cooker effect inside your torso. This excessive internal pressure forces your prostate and surrounding tissues into an unnatural compressed state. The result is increased inflammation, reduced blood flow, and potential urinary retention that can last hours after your workout. Men with existing prostate enlargement find this pressure particularly problematic, as it exacerbates their existing symptoms. The breathing pattern you use during exercise directly affects your pelvic floor muscles and prostate function. Proper breathing actually helps massage and decompress the prostate area, promoting healthy circulation and reducing inflammation. When you hold your breath, you're doing the exact opposite, creating tension and restriction in the very area that needs gentle movement. This explains why many men notice increased urinary urgency or difficulty immediately after intense weightlifting sessions. The solution is learning to breathe rhythmically throughout each exercise, exhaling during the exertion phase and inhaling during the release. This breathing pattern reduces internal pressure while still providing core stability and power for your lifts. It takes practice to break the breath-holding habit, but your prostate will thank you for making this adjustment. Speaking of adjustments, the second habit I need to discuss involves something most men think makes them stronger, but actually makes their prostate problems much worse. The second devastating habit is loading your exercises with excessive weight that forces you to strain beyond your body's natural capacity. Many men believe that heavier weights automatically translate to better results, but this approach creates tremendous stress on your pelvic floor muscles. When you lift more weight than your body can handle with proper form, you compensate by recruiting muscles inappropriately. This compensation pattern places enormous pressure on your prostate and surrounding structures, leading to inflammation and urinary dysfunction. Stick with me until the end of this video, because the information I'm sharing could prevent serious complications down the road. Excessive loading doesn't just affect your prostate during the workout, it creates lasting inflammation that can persist for days. This chronic inflammatory state is one of the primary drivers of benign prostatic hyperplasia progression. The constant pressure and strain from overloading exercises essentially teaches your body to maintain tension in the pelvic region. Heavy lifting with poor form also disrupts the delicate balance of your pelvic floor muscles, which are crucial for urinary control. When these muscles become chronically tight from excessive straining, they lose their ability to relax properly. This leads to symptoms like urinary dribbling, incomplete bladder emptying, and increased frequency of urination. The irony is that men often increase their weights thinking they are building strength, when they are actually creating weakness in their most important muscle groups. The alternative approach focuses on moderate weights that allow you to maintain perfect form throughout every repetition. This method actually builds more functional strength while protecting your prostate from unnecessary pressure and inflammation. Quality of movement should always take precedence over quantity of weight, especially for men over 50. But even with perfect form and appropriate weights, there's a third habit that can completely undermine your prostate health. The third habit that's damaging your prostate is training intensely without allowing adequate recovery time between sessions. This approach floods your system with stress hormones, particularly cortisol, which has been directly linked to prostate inflammation. When cortisol levels remain elevated due to overtraining, your body stays in a constant state of inflammatory response. This chronic inflammation doesn't just affect your muscles, it specifically targets hormone-sensitive tissues like your prostate gland. Continuous high-intensity training without proper rest disrupts your body's natural healing processes and hormone production. Your prostate relies on balanced hormone levels and adequate recovery time to maintain healthy function and size. When you train day after day without rest, you're essentially forcing your prostate to operate under constant stress. This stress manifests as increased urinary symptoms, reduced flow rate, and greater risk of urinary retention. The lack of recovery also prevents your pelvic floor muscles from properly relaxing and resetting between training sessions. These muscles need time to release tension and restore their natural flexibility, just like any other muscle group in your body. Without adequate rest, they become chronically contracted, creating persistent pressure on your prostate and bladder. This explains why overtraining often coincides with worsening urinary symptoms in middle-aged men. Proper recovery includes not just rest days, but also active recovery techniques like gentle stretching and light movement. Your training schedule should include at least 2 full rest days per week, with additional lighter days focused on mobility work. This approach allows your cortisol levels to normalize while giving your pelvic tissues time to decompress and heal. However, even with perfect training frequency, there's a fourth habit that most men completely ignore, yet it's absolutely critical for prostate health. The fourth habit destroying your prostate health is completely ignoring stretching and mobility work for your hips and pelvic region. Most men focus exclusively on building muscle and cardiovascular fitness while neglecting the flexibility component entirely. This creates a rigid, poorly circulated pelvic area where inflammation can easily take hold and persist. Without regular stretching, your hip flexors, glutes, and pelvic floor muscles become chronically tight, restricting blood flow to your prostate. Tight pelvic muscles create a compressive environment around your prostate that promotes inflammation and reduces its ability to function properly. When your hips lack mobility, every movement you make throughout the day creates additional tension in your pelvic floor. This constant tension is like having a vice grip around your prostate, preventing normal expansion and contraction of the gland. The result is increased urgency, reduced flow, and more frequent urination episodes. Poor hip mobility also affects your posture and movement patterns, creating compensations that further stress your pelvic region. When you can't move your hips through their full range of motion, your lower back and pelvic floor muscles work overtime. This overwork leads to muscle fatigue, trigger points, and referred pain that can mimic or worsen prostate symptoms. Many men don't realize that their urinary issues are actually related to muscular restrictions rather than prostate problems alone. The solution involves daily stretching focused on your hip flexors, piriformis muscles, and lower back extensors. Gentle yoga poses like child's pose, pigeon stretch, and cat-cow movements can dramatically improve pelvic circulation and muscle flexibility. Just 10 minutes of targeted stretching each day can reduce pelvic tension and improve prostate function within weeks. But there's one final habit that's perhaps the most overlooked yet most important for long-term prostate health. The fifth and most critical habit is completely ignoring your pelvic floor muscles while focusing exclusively on external muscle groups. Most men spend hours training their arms, chest, and legs while never once thinking about strengthening the internal muscles that control urinary function. These deep pelvic muscles are essentially the foundation that supports your prostate, bladder, and bowel control. When they are weak, everything above them suffers, leading to progressive urinary dysfunction and prostate complications. Your pelvic floor muscles work like a supportive hammock beneath your pelvic organs, providing stability and control for urinary flow. When these muscles are weak, they can't properly support your prostate or help control the opening and closing of your bladder. This weakness manifests as urinary dribbling, incomplete emptying, and reduced force of urination. The problem worsens over time because weak muscles get progressively weaker without targeted strengthening exercises. Strong pelvic floor muscles also improve circulation to your prostate by creating a pumping action that moves blood and lymphatic fluid through the region. This enhanced circulation helps reduce inflammation and promotes healing of prostate tissues. Additionally, these muscles play a crucial role in sexual function, so strengthening them provides multiple benefits beyond just urinary control. Most men notice improvements in both urinary symptoms and sexual performance when they begin pelvic floor training. The most effective exercises for pelvic floor strengthening include Kegel exercises, bridge poses, and deep breathing techniques that engage these internal muscles. Start with gentle contractions held for 3 to 5 seconds, gradually building up to longer holds and more repetitions. Consistency is more important than intensity with pelvic floor training, so aim for daily practice rather than occasional intense sessions. These exercises can be done anywhere without special equipment, making them the most accessible yet most neglected aspect of men's fitness. Join the Members Club and drop a super like on this video if you found this information valuable for your health journey. Let me quickly summarize the 5 worst exercise habits that are sabotaging your prostate health right now. First, holding your breath during exercises creates dangerous pressure spikes that inflame your prostate and restrict urinary flow. Second, using excessive weights forces harmful compensation patterns that stress your pelvic floor muscles beyond their capacity. Third, training without adequate recovery keeps your cortisol levels elevated, promoting chronic inflammation throughout your prostate and pelvic region. Fourth, ignoring stretching and mobility work creates a rigid, polar-circulated environment where prostate problems can flourish unchecked. Fifth, neglecting pelvic floor strengthening leaves the foundational muscles weak and unable to properly support your urinary system. Each of these habits might seem minor individually, but together they create a perfect storm for prostate dysfunction. The key message I want you to remember is that it's not about training less, it's about training smarter. Small modifications to your current routine can transform your workouts from prostate-damaging to prostate-protecting activities. These changes don't require expensive equipment, complicated techniques, or dramatic lifestyle overhauls. They simply require awareness, consistency, and a commitment to long-term health over short-term ego satisfaction. If you're over 50 years old, your exercise routine needs to be specifically adapted to protect your urinary and prostate health. The same approaches that worked in your 30s and 40s may now be working against your body's changing needs. Subscribe to this channel for more evidence-based health content specifically designed for men over 50. Share this video with other men who need this information, and remember that taking care of your prostate today determines your quality of life tomorrow.